So these are the scope of the cardiothoracic nursing in India and abroad. You just go through this, the operation theater, the cardiac surgery ward, coronary care unit, like the industrial nurses. Yes. Next slide, please. These are the references. Thank you very much. So if you have any queries regarding this, you can ask me.
Thank you, sir, for the nice presentation. Since there is a shortage of time, we would like to skip the query part. And if there is any queries, we'll leave the email address of Mrs. Neeraj Swarnakar, sir, in the chat box. Candidates can contact sir and clarify their doubts. So thank you, Neeraj, sir, for your enlightening presentation. We were glad to have you among us today.
Thank you so much.
Thank you, sir. Now let us move on to the next session in the scientific session. Let me introduce the next speaker for the day, Dr. S. Venkatesh. So Dr. Venkatesh is going to talk on COVID-related cardiovascular problems and their interventions. Sir is currently working as a lead interventional cardiologist at RV Aster Hospital, Bangalore. Sir has done his MBBS, MD in cardiology, where he was the batch topper and also won the first order medal in PGI Chandigarh. And he pursued his DM in cardiology in the same institute as well. And to talk about his clinical achievements, Dr. Venkatesh has done nearly 15,000 diagnostic
catheter.
Yes, sir.
Can you hear me? We'll skip the introduction part. I have a patient who is on the table. I have to go.
Sure, sir. No problem.
We're already late.
So we are eager to hear from you, sir. Over to you.
Thank you very much. And thank you for inviting me. I thank all the organizers, Professor Mamta, for having me here. Congratulations, the RGHS and RV Dental College for conducting this beautiful seminar. We heard Mr. Neeraj, he spoke so well about the problems of cardiovascular nursing. Nursing in general, there's so many good things he said about the trends in cardiovascular nursing. Some of the points which I really liked what he spoke was the hierarchical approach which we take in a hospital, and how lack of coordination has led to reduced recognition of nursing professionals in hospitals. And we have seen during this pandemic that cooperation between professions, doctors and nurses, is extremely important for patient care. And in a way to say that I think nurses are as knowledgeable about COVID as doctors are during this time. So I think it's very important to take up these points and make sure that the collaborative efforts, whether it is in terms of disease identification, whether it is in terms of disease therapy, or in terms of research, there is a collaborative effort between nurses and doctors, and nurses have to contribute a lot more, and the hospital environment should allow this contribution a little more. Now, coming quickly to this cardiovascular manifestations of COVID disease, I'll go very simply. I won't present any slides. I will just tell you what happens and what is going on. Now, as we all know, COVID disease is caused by this SARS-CoV-2 virus. And we know that there is something called as a spike protein, the S spike on the surface of this virus. And this spike protein is one of the most important pathogenic mechanisms because of which COVID virus affects our body. So there are two stages in the response of our body to COVID virus. So in the first stage, this spike protein attacks those cells which have an expression of a certain protein. Now, what are we talking about? There is a receptor called as ACE2 receptor. The angiotensin convertase enzyme receptor is there. This is typically present in the lung cells, the pneumocytes. These are also present in other tissues like the kidney, the endothelium, and some other tissues in the body. Now, whichever cells have this ACE2 receptors, the spike protein can go and attach itself to that receptor. And because of this attachment, the COVID virus then gets entry into the cell, and there is destruction of these cells which are expressing these ACE2 inhibitors, which is why the lung cells are especially at a risk of being attacked by the COVID virus, the SARS-CoV-2 virus. which is why the respiratory system is the most commonly affected. So this is what happens in the first stage of infection of the COVID virus. The SARS-CoV-2 enters these cells which have an expression of ACE2 receptors, and it starts destroying this. During this destruction, there can be manifestations, and also there is some kind of immune response to this protein and the rest of the virus. And this immune response is manifested as a cytokine storm or some other immune mechanisms which are put in, which can lead to various manifestations of COVID virus. This is in the first stage. In the second stage, because of all this immune response and destruction of the cell, there is inflammation in the body, and that causes further manifestations of COVID virus. So this is how, in general, SARS-CoV-2 affects the body. Now, coming very specifically to cardiac problems, all of you who have studied about the COVID virus, as well as all of you who have actually worked in the COVID ICUs and wards, know that cardiac manifestations are very important for COVID in the COVID disease. What are we mainly seeing is that, number one, we are seeing myocardial injury, the injury to the heart muscles or the myocytes. Myocarditis is also seen. We also see a lot of acute coronary syndromes or acute myocardial infarctions because of COVID virus infection. We see heart failure. Heart failure, is inability of the heart to pump adequate blood according to the needs of the body. So there is an increased incidence of heart failure, and there are arrhythmias which we see. Either bradyarrhythmias or tachyarrhythmias are seen. So these are generally the 5 different classes of problems that we see in SARS-CoV-2 infections in human beings. Now, myocardial injury or myocarditis could be directly because of the SARS-CoV-2 virus attacking the myocytes, because, as I said, the ACE2 receptors are expressed on many tissues, and one of the tissues where it is expressed is also the cardiac myocyte. So when there is an injury to the cardiac myocytes because the ACE2, the SARS-CoV-2 virus directly attacks it, there is inflammation of the myocardium, and it causes myocardial injury and myocarditis. This is not uncommon. It can happen in many coronaviruses, other respiratory infections. Like, for example, all of you might know that during the H1N1 infection as well, we saw a lot of patients coming down with myocarditis. The heart pumping, which was quite good before, after the infection can go down because of this. So this myocarditis can be an important manifestation of SARS-CoV-2 infection. The other important problem which we saw during COVID pandemic, both in the first wave as well as in the second wave, is acute myocardial infarction or acute coronary syndrome, which is directly due to SARS-CoV-2 virus. Now, why does this happen? There are 2 mechanisms which are proposed. We know that many of our patients have atherosclerotic plaques inside the coronary artery. When there is an inflammation in the body, or when there is a adrenergic crisis, if a patient has a lot of inflammation in the body, the pulse rate goes up. Sometimes the blood pressure fluctuates widely, and there is sympathetic stimulation in the body. So because of this adrenergic crisis, the plaque in the atherosclerotic plaque in the coronary artery can rupture, and when there is an atherosclerotic plaque rupture, one can have an acute myocardial infarction. The other thing which we know in SARS-CoV-2 infection is that there is an increased tendency of clot formation. You have all heard about this. There is more thromboembolic complications in the body due to COVID infection. So in the heart as well, if there is coronary thrombosis, that can cause acute coronary syndromes or acute myocardial infarction. Patients can present with chest pain, unstable angina, non-ST elevation myocardial infarction or even ST elevation myocardial infarction. So this is the second most important problem which we see. Other than myocarditis, the next important problem we see is acute coronary syndrome or acute myocardial infarction. Heart failure, because of various reasons, whether it is due to reduced heart pumping or whether it is because of diastolic dysfunction, we see a lot of patients with COVID infection coming with heart failure. We also see this in patients who are admitted in the ICUs for they go into heart failure in addition to respiratory failure, and we need to recognize this and treat the heart failure in addition to the respiratory failure. So this is the third important thing which we see. The thromboembolic complications which I mentioned inside the heart can also happen in other places. For example, we saw a lot of patients with pulmonary thromboembolism. We saw a lot of patients with deep vein thrombosis. Similarly, these thrombotic episodes can happen in the brain leading to stroke. So in the cardiovascular system, excessive clot formation or the thromboembolic complications can happen because of SARS-CoV infection. You must also remember that in a small number of patients who are receiving certain vaccines, you could also have thromboembolic complications, but the number of thromboembolic episodes that happen because of the vaccination is extremely low. For example, if you look at thromboembolic complications, in general, about 1 in 3 million people in the general population can have thromboembolic complication, but when vaccinations are given, this can increase to 1 in million. So, unfortunately, we see that a lot of our patients, our family members are refusing to take vaccines because they are worried that there can be thromboembolic complications, clot formations can happen. So people see social media and get scared and they do it. As health professionals like doctors and nurses like yourselves, it's our duty to reassure patients saying that these complications are extremely rare so that we can take vaccinations. So the other complication of SARS-CoV-2 infection is thromboembolic complication. The last one I would like to mention is what is called as arrhythmia. We commonly see, and if you have worked in the COVID wards and ICUs, you will see that a lot of these patients have lower heart rate. The pulse rate is on the lower side. So bradycardia is commonly seen in SARS-CoV infection. Then, of course, there are patients who have tachycardia because of their hypoxia or because of their cytokine storm and hypotension. But in addition, there are some patients who can present with cardiac arrhythmias like atrial fibrillation, ventricular tachycardia, and some people can even come with sudden cardiac arrest because of these arrhythmic complications. So these are basically the 5 important cardiovascular manifestations which we see: myocardial injury, myocarditis, acute coronary syndrome, ST elevation myocardial infarction. You can have thromboembolic complications, including stroke, arrhythmias, and a complication of all of this is, of course, shock. So in a given patient who comes to us with a cardiovascular manifestation to the hospital, we see 2 types of patients. One of them is got a florid COVID infection. Fever is there, cough is there, respiratory failure is there. Some of them may even get admitted into the ICU. And then we notice these complications to have happened. The other thing which we see is patients who primarily come with a cardiovascular complication. Like, for example, a patient comes with an arrhythmia or a patient comes with an acute myocardial infarction to the emergency. When we examine, there are no other manifestations of COVID infection. However, on testing, we find that the patient also has COVID in addition. So these patients who are relatively asymptomatic for COVID can develop cardiovascular complications. So it is very important for us to recognize cardiovascular manifestations of COVID in both these settings. One is a patient who is on a ventilator, who has got a respiratory failure, who has a hypotension, who has tachycardia, who has hypoxia, additionally develops a myocardial infarction or a pulmonary embolism. We should be able to recognize that, because only treating the respiratory part of that patient will not make sure that he will come out of this alive. That patient has to be additionally treated for the cardiovascular manifestation. That is on one side. The other side, patients who have no COVID symptoms, When they come to the emergency with a cardiovascular complications like a myocardial infarction or a pulmonary embolism, it is very important for us to recognize that these could be a manifestations of underlying COVID. Why? Because number one, such patients should be treated as severe COVID infection and all the SARS-CoV-2 antiviral, etc., which have to be given. And also, these patients have to be appropriately isolated so the other patients or as well as the healthcare care professionals are not under risk. So these two precautions we have to see. There is a third class of patients which we also see, that is patients who have an underlying heart disease. Somebody has undergone a bypass surgery or somebody has had a heart attack in the last year, develops a COVID infection but has no cardiovascular complication COVID infection. A patient has had a stent implanted or a pacemaker implanted, or there is a patient with underlying hypertension develops COVID infection. When they come, what we have to understand is while we treat the COVID infection during that time, we should also be mindful that their underlying cardiac condition, which is at present not causing any complication, must also receive continuous treatment. We very commonly see two situations. One of them is an old cardiac patient comes to the hospital with COVID. All his COVID treatment is given, but we forgot to give his cardiovascular medicines. His important heart medicines are stopped. Because of that, the patient can have a myocardial infarction or worsening of heart failure. So, or an arrhythmia can be precipitated. That is very important that we have to be mindful about that. The other problem is whenever patients are going to the vaccination center, unfortunately, because of lack of knowledge of the vaccinators, which includes sometimes doctors and even nurses, they are telling that if you are taking any medicines, stop them for 3 days and then come and then only we will give vaccinations. Many of our patients, unfortunately, stopped medicines to receive COVID vaccination, and because of that, they had a precipitation of a cardiac event. Commonly, people are telling that you should stop blood thinners before taking COVID vaccination. Now, this is not true. Let me educate you at this point of time, because as health information providers to your family, your patients, your friends, you should know that there is no indication for stopping any medicine for receiving COVID vaccination, and that includes blood thinners. So if a patient is on aspirin or clopidogrel or oral anticoagulants, there is no need for patients to stop these medications to take the COVID vaccination. It is possible that sometimes the patients who have an underlying heart disease, they may want to consult a doctor to see whether it is safe to continue these medicines. But off the cuff, we should not be telling any patients to stop any medications during this time. Now, when it comes to cardiovascular manifestations, how do we treat the patients with these cardiovascular complications during SARS-CoV-2 infection? The general rule is that there is no difference in treating cardiac manifest. 1 second. Yes,
Post stent, give me one flow only, sir.
It's okay.
It's not.
I'm talking.
The flow is very low.
It's okay.
But
Put an
everything
IABP.
has been done.
Sorry, there is some. So the treatment of the patient is similar to a non-COVID patient. So when a patient comes with a heart attack or a heart failure or a pulmonary embolism, additional to diagnosing the COVID infection, the rest of the treatment remains the same. In that sense, what we have done is, in our hospital, for example, if a patient with acute myocardial infarction comes, even if the patient has a COVID infection, we say follow exactly the same protocol for treating them. We give thrombolytic therapy or take the patient up for a primary angioplasty, regardless of their COVID status. Only precaution what we take, and I think it has become universal everywhere across the world, is that before shifting the patient into the ICU to thrombolize, or before taking the patient into the cardiac cath lab to